Your doctor has just told you they want to put radioactive spheres inside your body and leave them there permanently. That sentence can stop you cold. So before you go anywhere else, take a breath, because what you're about to hear is going to make a lot more sense than that one sentence did. I'm an interventional radiologist, and in the next few minutes, I'm going to walk you through exactly what Y90 radioembolization is, what you'll experience, and what happens to your body and to the people you love after it's done. We're going to use a simple framework I use with every single patient. What enters, what leaves, what stays. Let's start. Y90 radioembolization, also called SIRT, which stands for Selective Internal Radiation Therapy, is a treatment for liver tumors. It could be a primary liver cancer or cancer that has spread to the liver from somewhere else. Here's why your team might recommend it. Liver tumors depend almost entirely on a specific set of arteries to survive. They need that blood supply to grow. Y90 exploits that weakness. Instead of sending a chemical through your entire bloodstream or aiming a beam of radiation at you from outside your body, your IR team navigates directly to the artery that feeds the tumor and delivers treatment there. Only there. That is the whole point of the word selective. Selective Internal Radiation Therapy. Now, here's something important. Y90 radioembolization is actually a two-step process. Before treatment day, you'll have a separate appointment called the planning angiogram. Some teams call it the mapping angiogram or the workup. This first procedure does something critical. It maps the blood vessel anatomy leading to your tumor. Your liver has a complex system of arteries. Some patients have small connections, called shunts, between those arteries and other organs, like the lungs. At the planning angiogram, your team checks for those connections. They often use a test agent, a labeled tracer, and then do an imaging scan to see how the flow behaves. If the scan shows that shunting is within a safe range, you're cleared for treatment. If something needs to be adjusted, the team uses that information to modify the plan. Sometimes they'll close off a small vessel first or recalculate the dose. That's not a failure. That's the safety system working exactly as it should. This planning step is also where the team calculates the specific treatment plan for your tumor, tailored to you. Treatment day. Let's talk about what actually enters your body and how it gets to your liver. The procedure starts with a very small nick, about the size of a pencil tip, in the skin of your wrist or sometimes your groin. That spot is numbed first with a local anesthetic. You'll feel a brief sting from the numbing injection, but nothing after that. Through that opening, your doctor introduces a thin, flexible catheter, a tube about the width of a thin noodle. Using live X-ray imaging, called fluoroscopy, they guide that catheter up through the arterial system, through the major vessels of your abdomen, and into the hepatic artery branches that feed your tumor. This requires real precision. The team watches every movement on a monitor in real time. You're resting comfortably with sedation while this is happening. The catheter is positioned precisely, not approximately, precisely. One of the questions I hear most often is, will I feel it? Will it hurt? For the procedure itself, most patients have what we call moderate sedation, or sometimes light general anesthesia depending on your center. You'll be relaxed, comfortable, and breathing on your own. Blood vessels don't have pain receptors the way your skin or muscles do. The catheter traveling through your arteries is not something you feel. The access site, your wrist or groin, is the only place with any sensation, and that's numbed. After the procedure, in the days that follow, that's a different story, and I want to be honest with you about it. Most patients experience what we call post-embolization syndrome. That means fatigue, mild to moderate discomfort in the upper right part of your abdomen, or sometimes your right shoulder, and possibly a low-grade fever. These are expected. They're part of your body responding to the treatment. Your team will prescribe medications to keep you comfortable. This typically settles within a few days to about a week. Now, the moment the procedure is named for, once the catheter is in exactly the right position, a liquid solution containing millions of tiny microspheres is slowly infused through the catheter. These spheres are much smaller than a grain of sand. They flow with the blood, but only as far as the smallest vessels of the tumor where they become lodged. They do not flow past the tumor into healthy tissue in significant amounts. The positioning of the catheter is designed to keep them right where they need to be. The infusion is slow and controlled. The patient typically feels nothing during this step. And then, once the infusion is complete, the catheter is removed. The access site is compressed for a short time to stop any bleeding. The procedure is done. The catheter leaves. And this is the part that matters most, and the part that understandably feels strange. The microspheres stay. Y90 is a radioactive material that emits a type of radiation called beta radiation. Beta radiation is very short range. It travels only a tiny distance, a few millimeters, from each sphere. That means the energy is delivered right where the spheres are sitting, inside the tumor's blood vessels. It does not travel through your body. It does not reach your other organs. It is not like a beam of radiation aimed from outside. It is local, contained, and targeted. Over a short period, a matter of weeks, the Y90 undergoes radioactive decay. The radioactivity decreases over time and eventually becomes essentially zero. After that, the microspheres remain in the tumor permanently, but they are biologically inert. No radioactivity, no ongoing effect. Just tiny spheres in tissue doing nothing. The tumor's blood supply has been blocked, and the tumor tissue has received targeted local radiation from the inside. That is what stays, and that is the entire mechanism. Let me be completely honest with you about this one, because you deserve a straight answer. Yes, for a short period after the procedure, you will be mildly radioactive. But here's the context. The radiation is beta radiation, very short range. It is largely absorbed by your own body and does not travel far beyond your skin. There is also a very small amount of a secondary type of radiation called Bremsstrahlung, which can travel a bit further. This is why the team gives you precautions. Those precautions are brief and specific. Your team will give you a written card before you leave. It will typically include maintaining some distance from young children and pregnant women for a defined period, guidance on shared sleeping arrangements during that time, any other specific instructions for your situation. Most routine contact with other adults in your household is addressed in the card. Your team knows your specific situation. These are precautions, not quarantine. Most patients go home the same day or after one night's stay. The period of precautions is short, and then it's over. Your team has seen this many times. Follow the card, ask your questions, and call if anything is unclear. That is exactly what the care team is there for. I want to clear up a few things I hear often, because misinformation about radiation can cause a lot of unnecessary fear. Myth 1. The radiation will spread through my whole body, like chemotherapy. That is not how Y90 works. The microspheres are lodged in one place. The beta radiation travels only a few millimeters. This is fundamentally different from systemic treatment. Myth 2. I'll be dangerously radioactive. I'll have to stay away from everyone for months. The precaution period is short. The written card your team gives you is practical and specific. You are not a danger to healthy adults in normal circumstances. The precautions are primarily about young children and pregnant women, for whom any extra caution is always prudent. Myth 3. The spheres might travel to my lungs or brain. That is exactly what the planning angiogram is designed to check. The shunting test, the catheter positioning, the sphere sizing, every part of the protocol is structured to prevent non-target delivery. Your team will not proceed if the safety conditions aren't met. Here's what to expect after you leave. Fatigue. Rest when your body tells you to rest. This is real and common, and it passes. Discomfort. Upper right abdominal discomfort, sometimes extending to the right shoulder, is expected. Your team will prescribe medications. Use them as directed. Low-grade fever. A mild fever in the days following is part of the normal response. It is not an infection. If it is high or prolonged, call your team. Nausea. Anti-nausea medications are prescribed. Eat light, stay hydrated. What you won't have, You will not lose your hair. You will not have the immune system effects of chemotherapy. This is a local treatment. Follow-up is important. Imaging, usually a CT or MRI scan, will be scheduled weeks after the procedure to see how the tumor is responding. Lab work will monitor how your liver is doing, and if anything concerns you before that appointment, fever that worries you, severe pain, yellowing of your skin or eyes, confusion, call your team. Don't wait for the scheduled visit. Your team will give you clear escalation criteria. Write them down and keep them visible at home. Let's bring it all together. A thin catheter enters through your wrist or groin. Guided by live imaging, it travels to the artery feeding your liver tumor. The catheter leaves, completely, once the microspheres have been delivered. Millions of tiny radioactive microspheres stay, lodged in the tumor's vessels, delivering short-range radiation locally as the Y90 decays over a short period. Once the radioactivity is gone, the spheres remain, permanently and harmlessly. You will be mildly radioactive for a short time. Your team gives you a written card with specific, simple precautions. That period ends, and it's done. This procedure was designed for precision, for targeting, for sparing as much of you as possible while treating the tumor. It's okay to have questions. Write them down. Bring them to your next appointment. And if this video helped you understand even one piece of what's ahead, that's exactly why we made it. I'll see you in the next one.